I was going to name this video More Confusing Medicare Stuff, but that could pretty much be the title to just about any video that I do. We go through the confusing parts of Medicare, and this is kind of a big one. So if you're on Medicare Advantage and you want to get off of Medicare Advantage and go back into original Medicare, which I highly recommend, and there's a number of reasons that you should want to do that. You likely know about Medicare open enrollment, annual enrollment period. They call it two different things. It runs from October 15th to December 7th. And you have to make your choice between those periods of time that become effective on January 1st so you can get off of your Medicare Advantage plan back into original Medicare. But what they don't really tell you is that's not the only time you can do it. And there's really not a whole lot of talk about the next time that you can do it, which is pretty much right after that. So it's crazy that they set up these timelines through Medicare. I'm not exactly sure why in the world they do it this way, but let's be really clear. If you want to get off of your Medicare Advantage plan, and again, I highly recommend it. Some of the reasons you might want to get off of your Medicare Advantage plan is, number one, your doctor left the plan. You're in the middle of treatment, your doctor is no longer in your plan, so you cannot go to that doctor anymore. That would be a crazy scenario to happen, but it happens all the time with Medicare Advantage. Number two, the hospital that you use no longer in the plan. So just about every year, hospitals, and a lot of times groups of hospitals, decide they just can't deal with Medicare Advantage anymore, and they leave the networks that these Medicare Advantage plans have, and you can no longer go to that hospital. Some Medicare Advantage plans have what they call out-of-network benefits, but when you try to use an out-of-network provider, you will likely find it much more costly and really cost prohibitive. You wouldn't be able to do it because of the amount of cost it would involve to use out-of-network. So it forces you to use the in-network provider. I want to take a quick minute and invite you to join my private Facebook group, Talking Medicare. It's a great place to find answers, to ask questions without having any pressure from other salespeople or insurance agents. It's a bunch of people on Medicare talking about Medicare with their experiences and things that they need to understand. So take just a minute, visit talkingmedicaregroup.com. It's absolutely free. You can join right there. Hope you find it very helpful. Enjoy the video. So those are big reasons you might want to get out of a Medicare Advantage plan. Other reasons would be you're tired of getting referrals, of going from a primary to a specialist. If you need to go to a specialist and you know you need to go to a specialist, in Medicare Advantage, most of the time, you have to go to a primary first and get them to okay it to allow you to go see a specialist. You don't have any of this stuff with original Medicare and a supplement. Everything is pretty much autonomous with original Medicare, and you don't have to jump through the same hoops that you do with Medicare Advantage. Another reason you might want to leave your Medicare Advantage plan is pre-authorization. If you've been in a situation where you have a medical issue and you're at your doctor's office and we decide that this is the course of treatment that we need to go on, first we have to get it approved by your Medicare Advantage plan. Again, not something that I would want to have to ask for permission, something my doctor says is the best way to go, and have to ask for permission from my Medicare Advantage plan. Again, you don't have that with original Medicare. Original Medicare, if it's medically necessary and your doctor says it's needed, that's it. You don't have to get pre-authorization to have something covered. So it's just a much, much easier way to go. A lot of people don't find this out until they're well into a Medicare Advantage plan, have a medical issue come up, and then all of a sudden you figure out, wow, it worked great when I was healthy, but now that I need it, it's going to not work the way that I want it to work. So those are certainly some reasons you might want to get out of your Medicare Advantage plan. Now back to the time period. So you have this open enrollment, annual election period, again, confusing, call it all sorts of different things. You have to do it between October 15th, December 7th, effective January 1st. But guess what? Come January 1st, there's another period of time. I call it the Medicare disenrollment period because it's set up really for people to get pushed into, sold into Medicare Advantage plans during this open enrollment period that maybe they haven't been in it before, and now they're all of a sudden pushed or sold into one, and they quickly find out that, wow, the doctors aren't what I thought they were, the hospitals aren't as available as I thought they were, and they want to get out and come back to original Medicare. So you have this period of time now that runs from January 1st all the way through the end of March. So you can make a decision anytime between that period and have it become effective the 1st of next month. So you could have it effective February 1st, March 1st, or April 1st. So these are times, again, that you can leave Medicare Advantage. Now, if you miss this one, guess what? You're locked in. And again, I don't understand why in the world they do that, but if you get past the end of March into April, you are stuck in your Medicare Advantage plan no matter what you want to do until January 1st of next year. So either you die and you get out, or you're in your Medicare Advantage plan until January of the next year. So you are literally locked in, even if you come down with a major health issue and the doctors that you need are not available in your Medicare Advantage plan, you have no chance to change. Even to another Medicare Advantage plan, you have to stay with what you have for the entire rest of the year. So it's crazy to lock into something like that. Again, original Medicare with a Medicare supplement plan, you can go to any doctor, any hospital, anywhere in the country. So you don't have any of that network stuff. But if something does change, if you got a premium increase and you want to change to another Medicare supplement plan, you can do it, just like you ought to be able to do it anytime that you want to do it. You can change to another Medicare supplement plan. Now, most states have medical underwriting, so you have to be medically healthy generally to be able to do it. But there are a number of states now that have what is called birthday rule, which gives you the ability every year on your or around your birthday to change supplement plans without medical questions. So it's getting much more easy to do that, but it's really not that complicated to begin with. So we have thousands of clients all on Medicare supplements. I don't have a single Medicare Advantage client because I do not want a Medicare Advantage client. If you're going to go Medicare Advantage, I'm sorry, but I'm not going to be able to help you. Now, I absolutely could. And what's more crazy about that, if I did sell Medicare Advantage, I literally would make about 3 times more than what I make helping people with a Medicare supplement. So that might tell you a little something there, certainly on the way I feel, that I would not personally have it. So therefore I won't sell it because I don't want to have the calls from people just constantly of problems and problems and problems. And then God forbid something more significant than that somebody couldn't get the care that they needed. And then something tragic happens because they were denied coverage. I want nothing to do with that. So Medicare supplement, again, there's no denial of coverage. You get whatever your doctor thinks you need. And if they want to try a different course of treatment, it's okay with original Medicare. Medicare Advantage, whoa, wait a minute, we try a different course. Whoa, that would cost money. So you just want to be in position to be comfortable with your health insurance as you get older. And I have personal experience with this. My mother, who's 90 years old right now, recently had an issue. She was in the hospital, and I'm just thankful she's on a Medicare Supplement Plan J, which is from the past. It's actually very good. They don't offer J anymore, but it's pretty much 100% coverage. But I don't have to worry about whether she's going to get what she needs and that it's going to be easy. There's really nothing to it. It is simply whatever she needs. And I can promise you also the doctors and the staff and the hospital also want to see you coming in with original Medicare. They don't want to see you coming in with Medicare Advantage because it just loads them up with paperwork, time that they don't have to put to care. So it's just a scenario that just makes all the sense in the world to me. So if you are in a Medicare Advantage plan, you want to leave, and we've come up past December 7th, you've still got more time. You can do it starting January 1st. There's kind of this blackout window between December 7th and January 1st. Again, weird stuff. But once January 1st comes, you can get out of your Medicare Advantage plan. You can sign back up to original Medicare with a supplement for the first of the month effective for the next month. So really not that complicated. That's what we do. We help everybody get that done, get it in place. So give me a call, fill out the form on my website, We handle everything for you. We do the enrollment into the Medicare supplement plan. There's nothing literally for you to do other than to get an email that confirms that this is what you want to do. So we handle it from start to finish, make it as easy as possible, and just try to help as many people as we possibly can. So please, let's get out of our Medicare Advantage plan. Let's get back on original Medicare if that's where you are. And then we won't have to think about health insurance anymore. So hope you found this helpful. Have a fantastic day.